Hi, friends. I hope that y'all are doing well today. I am again on location because that's my favorite thing to say at, look right here, Vertical Chiropractic with my good friends here today. And we are going to be asking some questions about all things chiropractic health, not only for mamas and daddies, but also for our kiddos. And so I'm really excited to introduce to you my new friend, Dr. Adams. And he is going to be answering all of my really tough questions that I'm going to ask him. Are y'all ready? Okay. So first, before we get into my list, can you tell us a little bit about yourself and about how in the world you became a chiropractor?
Yes, it's a great first question.
Yes.
So,
we don't want you to be a psycho. We need to know.
So I became a chiropractor for a couple of reasons. One, I had a chiropractor that really helped me as a child.
Okay.
When I was 3 years old, I had very severe ear infections. So I did tubes, I did antibiotics.
Right.
The tubes actually would fall out,
Mm-hmm.
and the antibiotics would never really clear it up.
Mm-hmm.
And so my parents had this crazy idea back in the day, let's go to a chiropractor.
Uh-huh.
And so they took me to a chiropractor and actually had some misalignments, or in science it's called a subluxation. I had some subluxations in my neck. And you knew that, right? And so, but I had some subluxations in my neck. The chiropractor helped to get the bones in my neck back into the right alignment.
Mm-hmm.
Okay, it helped the nerves that go to my eustachian tubes, or the tubes that drain out the fluids, function properly. And I have not had any ear problems since that time. And so, just that was one reason.
Mm-hmm.
As a chiropractic had a huge benefit in my life,
Okay.
And really helped with the trajectory of my health from a very early age. And so that's why I'm so passionate about not just being a chiropractor, but being a pediatric chiropractor as well.
Mm-hmm. Okay, cool. All right, so tell us a little bit about just your training history, what you've done to get to this point.
So I did my undergraduate at Northwest Missouri State. I
Okay.
did my chiropractic schooling in Dallas, Texas at Parker University.
Okay.
It's a great chiropractic school. And then I actually, Bailey, my wife, and I we did my residency, like post-grad internship in Golden, Colorado.
Okay.
One of the largest family practices.
I bet that was really rough, wasn't it?
It was tough.
Like really rough in Golden, Colorado.
No, I know. It was a beautiful place. It's actually one of the largest pediatric and family practices in the country.
Cool.
And so I got to do my training under Dr. Michael Viscarelli there. And it was a huge experience for me, not just clinically, but being able to relate to parents. And with us, we're actually expecting our first child in like 2 months. So we're super excited about that, but being able just to see, the benefits that chiropractic can have, not just for adults, but for kids and helping them be healthy from the get-go. It's a big thing.
Super, super. Okay, so I made a list of all the questions that I would want to ask you if I was going to bring my babies to come see you. I have a 7-year-old and a 3-year-old, and we also kind of got to know about you at the Fort Worth Moms blog because one of our team members brings her little one to come see you. So I've got all the questions that mamas want to know.
Okay, perfect.
The first one is, what in the heck is pediatric chiropractic care?
It's like the top question I get to.
So
really,
I honestly knew that mamas could come and pregnant mamas could come, but I didn't know about our kids. So set me straight.
So, well, most people think of chiropractic. They think of maybe like a car accident or a migraine or low back pain. Mm-hmm. But I kind of want to just dismantle all that. When you think of chiropractic, think about the nervous system. Okay. And your nervous system, it's your brain, your spinal cord, all the nerves that travel to every part of the body.
I have a lot of nerves.
You do? Yeah. It's good. And so we all do. And so, but the goal of chiropractic is to make sure that your nervous system is functioning at its best. Mm-hmm. And there's a very intimate relationship between your nervous system and your spine. And so we take care of the spine by making sure all the bones are in the right alignment, there's good motion, so that we can take care of the nervous system. Mm-hmm. When it comes to kids, especially with pediatric chiropractic, most kids, I always say most kids don't come in with like low back pain or neck pain.
I was wondering that.
One of the common things people think of, especially if the kid can't talk, right? It's not even possible. So
my 3-year-old's like, oh, mom, my back.
I know, it just doesn't happen. No. So with kids, though, it's what we see is more organ dysfunction. And so that's why we see a lot of kids for things like allergies, asthma, colic, sleeping issues, ear infections, just to name a few. It's more end organ dysfunction that's tied back to nervous system dysfunction. And so that's the approach that we take. And through our assessment technology, everything that we use, we're a very technology-driven practice to assess your nervous system, especially a kid, right? Find out how the nervous system is functioning. And then if there's any stresses or any limitations there, we want to improve the way the nervous system is functioning by making sure that their spine is, it's not just growing well, but developing well as well.
Has overall good supportive health.
Absolutely, yeah.
Okay.
Yeah.
Okay, so in my mind, it makes me a little nervous, especially on my little ones, for their like necks to be turned and their spines to be manipulated.
Yes.
So I'm just going to ask you point blank.
Yes, ask it.
Is it safe
Yes.
for my little ones?
Yes.
You're not going to pop their neck?
I don't. No. And actually, in our office, I don't do any twisting or popping.
Okay.
So I use an instrument. I don't have it on me, but I use an instrument for all my adjustments. Okay. It's very safe. It's very specific, and it's very gentle. Okay. With our kiddos, though, until they're about the age of 5, I don't even use that. I just use my hands.
Okay.
And literally, here's the thing: when it comes to kids, it doesn't take much for the bones to misalign and to affect the nerves. So it doesn't take much to put the bones back into the right alignment as well. So literally, like the amount of pressure you would use to push on your eye or to check the ripeness of a tomato it literally is. That's about the amount of pressure that you would use for your hands with the kids. So say a kid, less than 5 years old, they're, most of the time they're on their back the whole time. And it's about this much pressure. It's more of a sustained contact versus a twisting or popping type of a manipulative adjustment. I like just using my hands in a very, very gentle, sustained contact. Because again, and it could be the birthing process that causes some misalignments. It could be a tumble or a fall, especially if there's siblings involved. I see a lot of that, right? Yes. But just the sustained contact of the fingertip, really just about to check the ripeness of a tomato, is the exact amount of pressure I use with our kids to slide the bones back into the right alignment. And I'll feel it too when it slides back in. It's very gentle, and it just kind of releases all the tension and the tone of the muscle as well. And this is actually the instrument that I use with our adults, our pregnant moms. Okay. So there's no twisting or popping. And here's the thing: it's not that that's a bad thing. There's over 200 different techniques in chiropractic. I just choose to do things a little more specifically and a lot more gentle than others, maybe.
Yeah. Well, we like the sound of that, especially when we're talking about our babies.
That's right. Yeah.
Okay, so you've touched on it a little bit, but I want to ask you some more specifics. Like, why is pediatric chiropractic care important? Like, you kind of even mentioned, and who does it benefit? You just mentioned, like, infants after birth. That seems early to me, but are there benefits for that? And what are the other, like, types of kiddos that would benefit from this, like athletes or just give me the whole kind of spiel about like how this can benefit them and who those kiddos are.
Great question. So, and we see kids from just a few days old all the way through their teenage years. The number one reason we see a lot of kids is because of the birthing process. And I tell all of our moms, if it was 100% natural, everything went as planned birth, to on the other side of the extreme where things didn't go as planned. It does not matter. Any kind of twisting or pulling on the neck as that baby's delivered can affect the spine.
It's not a real smooth process.
I know.
It's a little traumatic.
It can be.
Absolutely.
And so, we always encourage our young parents to at least have their kid checked by a pediatric chiropractor to see if there are any misalignments or subluxations present. So you can get those corrected early on before they develop over time. And a lot of times, it can be misaligned without any pain or symptoms. But when we have kids come in, that's one of the first things that we do with our technology and with my analysis is to assess this top area of the spine to make sure that if the birthing process, like I said, was 100% okay or totally not as planned, it's okay. We want to just make sure that they're developing well. And then too, to look, when you look at the statistics today, this is why I'm very passionate about it. 1 in 9 kids have asthma. 1 in 8 kids ADHD.
My kids have
1 in 5 kids have some kind of mental or emotional disturbance or dysfunction, and the stats are only getting worse over time. And so why we exist really is to bridge the gap for families and for kids to achieve health naturally for the long run. And that's why I get so passionate about it, just because for me it made a huge difference in my life, and the kids that we take care of have had huge breakthroughs from acid reflux to sleeping better. I mean, it's and again, here's the thing. I don't claim to just treat a symptom. I think that's the big misconception with chiropractic is, somebody comes in, I don't claim to just treat a symptom, but the goal is to get their nervous system working better. And so as far as who it can benefit, we see just as many kids that have symptoms as we do that kids that don't have symptoms, but that their parents just want to help their spine develop well. So we see some of both. And really it's cool to see the kids that come in with symptoms and then maintain and get better where they don't have symptoms but want to maintain their health for the long run naturally. Yeah.
Super. Okay. All right. So what are some myths that you would like to dispel? Here's your chance. There's the mamas. What myths do you want to dispel about pediatric chiropractic care?
Well, I think you brought up one was a great question, was the adjusting, right? Because I'll have parents come in and I'll have dads look at me. They're like, "You're not going to hurt my baby."
Don't touch my
right?
baby.
And as we're expecting one in 2 months, and I'm like, gosh, I would never let anybody touch this thing, right? I think one of the big myths is that there's not any like a popping, twisting type of adjusting. It is a very gentle, very specific. But I will say you want to go to a pediatric chiropractor that's trained on those things.
Right.
Not all chiropractors see kids. Not all chiropractors see pregnant moms. We do, but I've done a lot of extensive training outside of schooling to get that certification so that I can take care of that clientele.
Yes. Good.
But with the adjusting, a lot of times I'll have parents say, "That's it." I mean, that's it. After the adjustment, say, "Yeah, it doesn't take much. It is. It's very gentle and very safe." Another one would be because I'll have parents they'll say, "Well, you see kids, but my kid doesn't have back problems, or my kid doesn't really have any issues."
No pinched nerves.
No pinched nerve, right? Which most people think. Chiropractic is so much more about than just symptoms and pain relief. It's more about helping the nervous system work better. And so when you think chiropractic, if you'll think nervous system, and every time that we provide an adjustment or that we check a kid or adult, the goal is to improve their nervous system. Because life is much better lived without nerve interference than it is with. And so that's why I'm so passionate about making sure that our kids are growing up healthy, so that because I always say healthy kids become healthy adults. And whether they're symptomatic or asymptomatic now, we can help them be healthier through a properly functioning nervous system.
Okay, great. All right, so tell me what a typical appointment would look like. I'm bringing my 3-year-old in. Give me the rundown.
Yeah, so on a first visit, what we do, we do paperwork, and we kind of sit down with you, go through, especially with our pediatrics. We'll have a pediatric paperwork we go through, and then we do our technology, our assessment. We actually use NASA published space certified technology that allows me to get an exact assessment of how the nervous system is functioning. So one of those that we do with our kids is the thermography reader. And if you think of thermography, think of heat. And so this is an assessment tool that I run up the spine, and it measures for where the bones in the spine shift out of alignment. But when those bones shift out of alignment, not only does it interfere with the nerves, it also causes inflammation at the joint. And that inflammation is what gives off heat along the skin of the spine. And so this allows me to take all the guesswork out and see where the stresses are at in the spine, whether the kid or the adult is feeling those stresses or not. I can see that, and especially be in the front end of those things as well. And so we do that assessment technology on the first visit. So like I said, take the guesswork out and give me a ground, or kind of lay the groundwork to how your spine is and how the nervous system is functioning. And then, I come up with specific recommendations, kind of a plan of action moving forward.
All right, perfect. So what can our readers do to schedule an appointment with you? What would their next steps need to be? If they're curious, maybe they just want to do, like you said, kind of like a consultation type thing before you get into any type of treatments. What are their next steps?
So the next step would be, I would say, to either email us or call us to set up a consultation. So typically on a first visit, we do a consult, a full neurological assessment. And then I sit down and go through all the results, because we print it all out. You can see how your body's functioning on the paperwork, and I go through all the results with you. Typically, that's about $85 to $100 for that first visit. But what we're going to do is something special for all the readers and the bloggers, that you guys are part of. Anybody that calls us, and it says that, hey, we're from Fort Worth blog, Mom's blog, we will do that for $20.
Hey, score!
So it's a discount that you can get. And,
super.
We do it. I do that for 2 reasons. Save a little bit of money up front, of course, but also the big reason is so that parents can come in and at least sit down with me and kind of ask me some questions. Because we'll have a lot of parents that come in and they'll look right at me. They're like, "Doc, we've changed the diet. We've switched up, this type of formula. We've done this. We've tried these medications. We've taken off medications. We've added others, and nothing's, sometimes that doesn't work." And so that's kind of like we're like the last resort almost. I'm like, no pressure, right?
Welcome to the last resort.
And so no, but it's a great chance that first visit to sit down with me, talk through their case, at least see if they're a neurologically based chiropractic applicant or if they would benefit from this. Absolutely. And if so, then I'll go out and lay out some recommendations moving forward. If not, if we need to find somebody else to take care of them, then we'll do that as well. But it's just a great idea or a great first step for parents to get their questions answered about what it is we do, why we see kids, and how we can help kids, like I said, symptomatic or not, improve their bodies so they're performing better, like with sports and through as they grow up, but also focus, sleeping better, all those are benefits that we've seen with kids.
Yay. Okay, yay, that's so exciting. So you heard it here first, ladies. If you want to try a consultation, you want to come hang out at Vertical Chiropractic, they do have toys in the waiting room. I saw them. The kids will be entertained. But $20 for your first consultation, and I can vouch, as you can see, he's very nice. And also, their office is very beautiful. I'll just tell you that. Just come here to see the shiplap. That's all I got to say. So if you have any more questions, feel free to put them in the comments, and we can follow up a little bit later answering those. We hope that y'all have enjoyed our time together and you have some of your burning questions answered. See y'all later.